Hi, everyone, and welcome to the next episode of Welln'ish. If you've ever been curious about naturopathy, then this episode is for you. Today I'm here with Ashley Florestal, a naturopath from Montreal. After completing her pre-med sciences, Ashley enrolled into a 4-year naturopathic doctorate, and she now works virtually from her website, fertilitae.com. Ashley is also an entrepreneur. She recently created an app also called Fertility, which has tons of naturopathic resources. In school, Ashley naturally gravitated towards the realm of women's health and eventually started her specialty in helping couples conceive through the naturopathic approach to fertility. So I'm super excited to have you here. Welcome, Ashley.
Thank you. Thanks for having me.
So I'd like to start off with the most obvious question because I'm always surprised at how many people don't know what a naturopath is. So I'd love to hear in your own words what exactly a naturopath is.
Of course. I'm not surprised, just because, like, especially if you're in Quebec, there's not really a definition of what a naturopath is because there's no formal education needed and there's no regulation. So basically, anybody can call themselves a naturopath.
Okay.
And there is lots of people that call themselves naturopaths that have lots of knowledge and they're able to help you. But then there's also a lot of people who like either take a weekend course, or they use like the insurance, right,
Yes.
to bill the insurance companies. But in the rest of Canada, so there's licensed provinces and there's licensed states in the US, and you have to become a naturopathic doctor. So you need 7 years of post-secondary education. So you have to have your bachelor, you have to do all the prerequisite science courses, and then you can go do this 4-year doctorate of naturopathy program. You do an internship, and then we write 2 series of board exams and practicals. And then you can go even further if you want, because we're trained in pharmacology. You can actually take a prescribing exam, and in certain provinces and states, you can actually prescribe medications as well. So
Can you do
naturopaths
that
are
in Quebec?
no. So in Quebec, we are not considered doctors. We're considered naturopaths. There's no regulation, so we can only give diet and lifestyle advice.
Okay.
But we still focus on the principles of preventative medicine, optimizing your health, and really getting to the root cause of what's going on. And if you're in another province or state and you want to find an ND, you can go on cand.ca or you can go on naturopathic.org and you can find an ND near to you.
Very cool. So would those websites that you talked about kind of help people find naturopaths who are more qualified than others? Like how, because there is that issue in osteo, so we always refer people to Osteopathie Quebec, and then everyone in there that's allowed into that association has a certain amount of qualification. Do you guys have anything like that with
Yeah,
Andes?
Yeah, so that's exactly what it is. So if you want to find a
Okay.
naturopathic doctor in Canada, you can go on that website. And then in the US, you can go on the US website I named. And all of those people have been to like the appropriate school. So there's only about like 7 schools you can go to that you're able to write those licensing exams. And those licensing exams are North American wide. So we all write the same ones.
Okay. So what would you say the biggest difference is between what a naturopathic doctor does and a conventional medicine doctor?
The biggest difference, I mean, yeah, they're different in the sense that a naturopath focuses really on like lifestyle medicine. We really focus on like diet, nutrition, and preventative medicine. Whereas a
Okay.
medical doctor focuses more on like family medicine. They diagnose, they treat.
Okay.
They treat mostly with medications and do like surgery. They're also highly trained in emergency medicine and surgery. Whereas you wouldn't see a naturopath for that.
Okay. Interesting. Thank you. So, how did your life and career bring you to this point? What made you switch from commerce into naturopathic medicine?
Well, so I've always wanted to do something in like health or wellness. That's always been my passion, and like nutrition as well. But then I've also always wanted to help people. That's like my biggest goal in life. And then I've also always wanted to be an entrepreneur. So everybody in my family is an entrepreneur. It's just like what you do. So business was like the most natural thing for me to go into first. But then I quickly
Same.
realized that, yeah, then I quickly realized like I do like business, but like it's not helping people the way I want it to. It's not focused on health. So halfway through my business degree, I realized I need to go pursue my passion. But I still finished my business degree, and then from there I went right on to getting all my sciences done, and then straight to ND school.
Okay, amazing. Very cool.
Yeah.
Um, Yeah, I'm just like you. I had to finish too. I can't start something and then not finish it. I knew after year one, I was like, this is not driving me in the way that I want to, but I still wasn't sure exactly what it is that I wanted. So I was like, I need to finish what I've started.
Yeah, I'm the same.
So, what made you want to focus on women's health, and then what kind of eventually led to a fertility focus?
So I've always been interested in women's health for sure and fertility. But I think the biggest driver is ever since I was a little girl, I've always wanted to be a mom. It's something that it's the thing that I've looked forward to the most in life. And working in fertility, you get to help people become moms. So that was really amazing. And then while I was in school, there was a fertility focus shift. So in our clinical year, we do a whole year in various clinics. There was an option to apply to the fertility focus shift. And I applied to it.
Very
and
cool.
I applied to it and I got on. And on that shift, the appointments, because they revolved around fertility and it was such an intense visit, and it's like a very personal thing, right? That you're getting to know the patient
Right.
for. It's not just like, okay, you have low iron or you have joint pain. It's really like you're struggling to make a baby. So the connections I made on that shift were really, really deep and intense. And
Absolutely.
some of those patients I'm even in contact with still. So it was just like a really amazing experience. And then on top of it, we all know people who have struggled with fertility, right? We all know someone who's miscarried or who's been having trouble or who's going through IVF. And then in our generation, it's a lot more common to talk about it, but it's also a lot more common because we're having babies later on in life. So it's just a lot more real, and I feel connected to it.
That's such a good response. Yeah, I couldn't agree more. All of my fertility patients, it's like you really have a deeper connection. And I think, like, after thinking about it, it's, yeah, it's just something that's so hard to talk about. And in the medical system, like conventional medical system, there is such a high demand that when you see a doctor, you're not getting that, like, a nurturing care that you would get from like someone like a naturopath, osteo. Like we have more time to give and more time to support and kind of go through all the questions, all of like the hamster wheel questions that they might have, and really offer also support in different ways. Like, you know, while they're waiting for tests and waiting on the medical system, other health things that they can implement into their life. And I find that so valuable. I'm always referring to naturopathy for anyone that I see for fertility. I think it's really important. Um, Moving on to the next question. I do find that the statistics are pretty interesting. So I was wondering if you could give us a few, like for example, how much fertility is there in the world? What is considered being infertile? How many cases are unexplained? And why is it that women are often the ones who are blamed for fertility? And what's the real stat there?
Of course. Okay, so your first question was like roughly how many couples struggle with fertility. So in Canada, 1 in 6 couples will struggle with fertility, and globally, it's about 15% of couples that have trouble. So it's quite
That's
a
a
lot.
lot.
Yeah, if you have like a group of friends, 1 in 6 of you most likely is going to struggle with fertility. So when are you considered infertile? So you're considered infertile after actively trying for 1 year if you're under 35. And if you're
Mm.
over 35, then it's after 6 months of trying.
Oh, why is there that difference
Well,
between
it's
the
really
one year?
oh, sorry.
But well,
It's
you,
yeah, it's really because like once you're over 35,
yeah,
like you don't have as much, right? Because egg quality declines with age. So you
yes,
want to take action much sooner. So
okay,
it's really about like when to seek treatment.
okay. So they'll want to see you sooner after the age of 35 if you're struggling, because the likelihood of your egg quality having decreased is higher.
Yes.
Okay, gotcha. That makes sense.
And what was your next
It
question?
was how many infertility cases would you say are unexplained?
So depending on like which stat you look at, it changed a little bit, but it's roughly 15 to 30%. And then that also goes into your next question about like how often is the female blamed versus the male blamed. So when we look at it, usually it's about 1/3 it's a female problem, 1/3 it's a male problem, and then roughly 1/3 it's unknown cause. So often we're like blaming the female, or or maybe we're not blaming the female. The female tends to take on the responsibility because like we're the ones getting pregnant. But really it's like roughly the same for male and female.
That blew my mind when I learned that in school. And I also wonder if there's a long way to go in terms of testing. Like, you know, for women, there's so many tests that they're put through, so many images, whereas men, from what I know, it's really just, you know, you analyze the sperm. So I just wonder if one day, you know, there'll be more tests to be able to have a better idea of what underlying causes are. Because I feel like when women are doing like 40 tests compared to men who, you know, go in once and have their sperm analysis, it does really seem like a bigger weight to carry for the women.
It definitely is, but I also think part of that is because, so if you're doing an IUI or an IVF, they can actually pick which sperm they're going to use. So I think they place less importance on that.
Okay, that makes sense. And just for people to know, so what does it mean? What does an unknown reason, what would that mean exactly? Like I guess
it's unexplained. So they can't say like who the problem, like there's nothing that they can find wrong with either partner.
After doing all of the tests.
After doing all the tests, they don't know what it is.
Okay. Perfect. And so what is a naturopath's role in helping with fertility? When should someone come see you? At what point? Should they come even preconception, thinking about having a baby? Or, what would your advice be?
So because our main focus is preventative medicine, coming to see a naturopath before you want to get pregnant is ideal. I see a lot of people who come in and they just are like, help me prepare to get pregnant. Because really you want your body to be in like optimal health before you start trying to get pregnant. You want to make sure that all of your nutrient deficiencies are restored. You want to make sure that like you're cycling regularly. And you want to make sure that any underlying issues you have are kind of resolved as much as possible so that you have the best chances you can at conceiving. So really coming to see a naturopath, we're really going to optimize your whole life, like every bit of your lifestyle, your diet, and all of every part of your health, really.
Okay.
Yeah.
Cool. And then how does it work when a client shows up in your office who's struggling? Like, what does a typical session look like? What are some of the main tests that you'll go through, or how do you help them in that process?
Yeah, so the first session is really like a deep dive into your overall health. So we're going to go over like your health history, your fertility history, your lifestyle, your diet, mental health, your hormones. And then it ends up also being a big part of the visit is just letting the client talk, because it's one of the first times that they kind of just like to let out their entire story. So that also feels really good for the person and to somebody who doesn't know anything about the situation, right? I'm sure like some people have like told their friends and their partner, but it's nice to tell somebody else. And then really what I do is I take all that information and I connect the dots. And then I do some detective work and figure out what's going on. But it's going to look really different if you're coming in just for like preconception health, just overall, versus like if you come in with a problem. I see a lot of PCOS cases where like diet and lifestyle can make a huge difference. So it's going to look really different if you're coming in for preconception health or if you're coming in for an actual hormonal problem. So really we do that initial visit, then I will like connect all the dots, make a plan for you, and then depending on what the goals are of the client, we'll set a nice roadmap to get to those goals. And it's very personalized as well.
Okay. So for people dealing with PCOS, do you have certain biomarkers that you track, or how exactly is it that you're tracking their improvement?
For a lot of PCOS cases, I mean, you can track biomarkers, but also just by the regularity of their periods, right? So their periods are going to start getting more regular, and their symptoms. So a lot of people with PCOS have hirsutism, so like they'll grow hair in certain places or lose hair on their head, and that will actually start to come back as well.
Interesting.
So yeah, just physical things you can see as well.
Is there something kind of universally that would help women with PCOS, or is it really for you case-by-case basis what you would prescribe?
Well, it's really case by case. There are like for a lot of PCOS cases, correct, like fixing your nutrition and balancing that blood sugar is going to make a world of the difference for sure. but it also depends on the driver of your PCOS. So it could be that it's insulin driven. It could be that it's testosterone driven, right? It could be inflammation. It could be have to do with your adrenal glands. So depending on like the root cause of your PCOS, that's really what we're going to address.
Okay.
But universally, like fixing somebody's diet to like a blood sugar balancing diet is going to make a world of a difference in any PCOS case.
Okay. And what should people bring to a first session with you? Should they come prepared with any documents or
Yeah,
like
so
that, or medical history, or what is something that is useful for you to receive on the first session?
something really useful, well, is to bring like any blood work that you have done from the past. That's really extremely helpful. And then also bringing a timeline. So if you have a really detailed fertility history, having a paper with a timeline of events that happened in your life and your whole fertility history, that really, really helps me.
Okay. And then do you support any women during pregnancy also? Would you follow them into that, I guess, third step?
Yeah, I focus more on preconception health for sure, but I can also help people manage the side effects of pregnancy. So, like when you have nausea or constipation or gastric reflux, and also making sure that you have a solid supplement and nutrition routine going into pregnancy will be really important too for your health during the pregnancy and also postpartum.
Okay. Amazing.
Yeah.
So I find, well, obviously, as you know, women, we function on a cyclical nature. So we're all kind of going through cycles, and obviously that changes if you have, people can have a varied cycle. But from your point of view, how can women help themselves at each different phase of their cycle? Let's say this is more talking about women whose cycles are regular. Is there anything that you would recommend kind of as like a global thing for women?
Yeah, I mean, the best thing to do is really to listen to your body for sure. But if we just kind of look at overall how we're feeling during our cycle, at the beginning, so day one is usually like your menstrual phase, right? So at the beginning of your cycle, you have your period. So usually we're feeling like really tired and low because we're losing lots of blood. So this is the best time just to listen to your body and actually relax if you're feeling tired. Also eating lots of like iron-rich foods is going to be good for you during this time.
Because you're losing iron through blood loss.
Exactly. So really focus on getting adequate nutrients. A lot of people during their period don't feel like eating certain things, but trying to get as much iron-rich foods as possible is always good. And then after that, when your period ends, you're going to kind of approach ovulation and you're going to start getting a lot more energy. We usually feel our best, like approaching ovulation, we have lots of energy. This is a really good time to get all of like your super high intensity workouts done if you're into that, or like running. It's a good time to do all of that. And also, a lot of healthy eating can be done during this period because you also have more control over yourself during that time. And then after ovulation, once we start getting towards the period again, we kind of like slow down a little bit. And then for some people, PMS kicks in. So lots of like low moods and things. During this time, it can be very tempting just to like eat junk food and not exercise and not do anything, but it's not ideal. So it'd be better if you can to not stop, but just slow down as you approach your period, right? So focus more on like Pilates and walking and yoga and more like restorative exercises, but don't just stop because that'll actually make your PMS worse. And then if you give into all those cravings, so like if you start giving into sugar cravings, that's going to make PMS worse as well, right? Those things are not good for our hormones. So if you can really just like slow it down, but not completely give up, that's a good idea. And really, like if your PMS is that bad that it's disrupting your life, it's really important to speak to your doctor about that because it shouldn't be interrupting your life to that extent.
Yeah. I always tell people, if your period affects the function of your life, like your functionality on a daily basis, that is not normal because we're just told all the time. I remember once in high school, actually at QAA, we both went to QAA, I went to the nurse's office with like an extremely bad stomach ache, like totally unrelated, and she just kept telling me, oh, that's your period, that's normal, it's okay. Turns out I was having a full-blown allergic reaction, like completely unrelated. And it's just, I just think back to that, and it's like, throughout our life, like I was so young at that point, but we're just constantly given the message that pain is normal as a woman. During your period, yes, it's so normal to have period pain. And yes, some cramping, I guess, can be normal, some discomfort, but if it affects your daily life, that was always my barometer for people to, fight to have it investigated. I don't know if you would agree with that or what your barometer is or what advice you give to your patients.
100%. If something's interrupting with your quality of life, something's wrong. If you have your period, you should feel like something because something is happening, right?
Yeah.
But if it's to the point where it's excruciating and you need to take multiple painkillers you can't tolerate, there's definitely something wrong. And you should definitely look into it more.
Okay. So we talk a little bit about conception. So it's funny, we're just talking about this. Maybe you could have a different answer, but so is it, I guess I get asked this a lot from people, is can you get pregnant outside of your ovulation window and what that means exactly?
Can you get pregnant outside of your ovulation window? Technically not. You really have to be ovulating to get pregnant, and that egg is really only viable for like 12 to 24 hours. So really you only have that 12 to 24 hours to get pregnant. Now we know sperm can live up to 5 days, right, in the reproductive tract. So if you have sex anytime before that, then you can get pregnant. So you can't really get pregnant outside of your ovulatory window unless like by chance you ovulate twice in that cycle. But really you can't. And that's also why, oh, were you going to say something?
No.
Okay. And that's also why, like, a lot of people take the pill for contraception, but if you really know when those like the fertile window is, you can't really get pregnant outside of that window. It's extremely rare that you would ovulate twice.
So I guess the misconception, I was speaking to a friend of mine who's a doctor, was that it's the ovulation that can happen. It's because she was saying it's really when your LH is peaking. So that, everybody thinks that, following an application will tell you it's exactly going to be these XY days. But there are sometimes, because we are such cyclical people, sometimes you change time zones, there's stressors in your life. Sometimes that can vary, that peak, I guess, which was like for her what she felt was the misconception with like getting pregnant outside your ovulation, because those days aren't falling exactly where they normally would without like testing your LH.
Exactly, yeah. So the day you ovulate could change in a cycle, for sure. But you're not gonna, you can't conceive if you're not ovulating.
Yes.
Yeah.
And how often do you recommend for your patients to be having sex to optimize their chances of getting pregnant?
So really, you want to be having sex every second day during your fertile window. That's a general recommendation. Now, if you don't want to track your cycle, because some people find this really stressful, then you can really just like have sex every second day during the month, but that can be really, really tiring. So typically, like, you want to do that during your fertile window.
And how do you recommend to monitor your cycles? What's your number one tip or suggestion to your patients?
Oh, so there's so many ways to actually track your cycle. It really depends what's the easiest for the patient. I mean, you could use all the ways if you want, or you can just pick one of the ways. So usually, you can use ovulation strips. So those are like the LH strips. They monitor the ovulation hormone. You can use basal.
And so for those ones, is that you pee on a strip every single morning?
Yeah.
Or
So
how do those work?
Yeah. So what you want to do is, so in a package of LH strips, it'll tell you which day you should start. Because what's going to happen is your LH is going to slowly rise. And once it peaks, that's when the egg drops. And then it's slowly going to go down. So you really want to make sure you're testing it before it goes up, because you'll miss the peak. And typically for like a 28-day cycle, that you want to start testing around day like 11. So you'll test like every day until you hit that peak. And then once you hit that peak, then you know, okay, in the next like 24 hours, I'm going to be ovulating, and you want to start having sex.
Okay.
Yeah. And then the next way would be, you could use a basal body temperature thermometer. And that's measuring like your core body temperature. And you do that when you wake up every morning. And how that works is that can be used to confirm ovulation. So after you ovulate, your body temperature is actually going to rise like 0.3 to 1 degree Fahrenheit. So you'll clearly see like a temperature rise after ovulation. So that's a good way to confirm ovulation. Now, that's not the best for everybody, because it's like, well, ovulation already passed. But the idea is you do that for like a good 3 months, and then you get to know like when you ovulate. And that's really something that I recommend to people with PCOS. because using ovulation strips isn't ideal for that population, because your LH when you have PCOS is usually always high. So you're going to keep getting positive LH strips your whole cycle. So it won't be very useful. So in those cases, like a basal body thermometer is going to be a good idea. Then you can also look at cervical mucus. So cervical mucus is a great indicator of ovulation. So cervical mucus changes throughout your cycle. And around ovulation, it gets like egg whites, like raw egg whites. And it'll happen like a few days before ovulation, around ovulation, and it can happen after as well. But around that time is when you're ovulating.
So what are the differences of the cervical mucus? How does it change throughout the different phases? So ovulation is egg white, and what other consistencies are there, just so people can see the differences?
Yeah, for sure. So at the beginning of your cycle, you have your period, so you don't really see anything. And then it's normal to either have like dry days or like creamy, and that's non-fertile cervical mucus. And then as you approach ovulation, then it's going to start getting more watery until it reaches like egg whites. And then after you ovulate, it's going to turn into something that's more creamy, and that's non-fertile cervical mucus. It's secreted because of progesterone. And it actually kind of like blocks the sperm. Whereas like the egg white cervical mucus kind of serves as like a sperm highway and also changes the pH of the vagina. Yeah.
Okay, interesting. So you mentioned PCOS. So for PCOS, would the cervical mucus test work or?
Yeah. I mean, sometimes they don't have a lot, but if they do have, then it can be something to monitor.
Are there any other gynecological conditions or that have any special consideration for tracking your period other than PCOS?
That's really the main one that one of them wouldn't work. You can also use cervical positioning. That's something that people might want to use. Like when you're ovulating, your cervix is going to be higher up to allow space for sex, and it's going to be softer, and it's actually going to be more open. So that's something that some people use as well. But really, out of all of the methods, it would really be like the ovulation strips that might be off for people with hormonal concerns.
Okay, perfect. Thank you. So I really wanted to ask you about the naturopathic view of the pill and how, in your world, you guys find that it affects women's fertility, and what your advice is to people. What I really liked about one of my naturopaths is well, I guess like osteo, everybody just assumes that we are anti-drugs, anti-conventional medicine, and that, we tell everyone to get off of it. And what I really liked about one of the naturopaths that I saw was like, she wasn't trying to shame me out of any drugs, but if, let's say, I was on the pill, or I know she was asking me at one point about certain vaccines that I had taken, and she was never looking at it as like, oh, you shouldn't have done that. She was just like, okay, since you had this or that, or you've been on that medication, what I want you to do is supplement with these things to kind of counteract the things that we know about certain vaccines or drugs or procedures or anything that, or conditions that someone might have. So I was just curious to get kind of your view and to get the message out there on the naturopathic view of the pill, since I think it's one of the most common things that women are pushed on from at a very early age.
Yeah, I mean, that's kind of a loaded question because a lot of naturopaths have like different views on the pill, I think. And I know you hear about like the whole post-pill syndrome and like that as well. But I'm very evidence-based, and I like to look at what the evidence is showing. And really, the evidence is showing like the pill doesn't affect your fertility. The pill is great. Like you can be a woman, do everything you need to do, right? You can have freedom to decide when you're going to have a child and not have to worry about anything. However, I do think that the pill kind of makes you lose touch with your cycle. Your cycle is something that it's one of your vital signs, right? It tells you about your health and how you're doing. And a lot of people that have been on the pill for many years don't get that. So after they come off the pill, it's kind of like learning about their body for the first time. So I do a lot of education on that. But coming off the pill, the majority of people are going to get their period within 3 to 6 months of coming off. It's a very small amount of people that won't get their periods after that. And I know you were saying about your naturopath saying that it like depletes certain vitamins and minerals. So we do know that the pill does does deplete some vitamins and minerals, but you just have to replenish those, right? So whether you want to come off the pill 3 months before trying to conceive, or like right away, depending on like what's going on in your life, you do want to make sure that you are starting that prenatal vitamin a good like 3 months before, because you want those stores to be replenished for sure, because it does deplete like B6, folate, B2, zinc, vitamin C, magnesium, selenium, and vitamin E, that we know. And the other thing is, what you need to think about is, why did you go on the pill in the first place, right? So if you went on the pill because you were having irregular cycles, or you had a lot of hormonal issues and you were put on the pill to sort of regulate your cycle, well, the pill, like, we know that it doesn't regulate your cycle, right? It kind of just like masks the symptoms. And for some people, like whatever they were at that point in their life, that's what they needed. And that's great that it helped them for that. But once you come off the pill, you're kind of going to be back to where you started. So if you know you went on the pill for something like irregular cycles, then just know that coming off, you're going to need to give yourself that much more time to kind of regulate whatever that was, to like balance those hormones. So for those people that went on the pill to correct hormonal issues, I suggest coming off sooner so that we have a longer runway to work with. But if you went on just for contraception, you had no hormonal issues, like no acne or loss of period, then when you come off, typically you'll see your period come back within 3 to 6 months. Some people even see their period come back right away, and it's extremely regular. Okay. Yeah, but there is a study showing like a delayed time to conception if you were on the pill, but that's really not for everybody. It's really a case-by-case situation.
That's really great to hear, because I feel like being in the alternative world, I just see so much negativity surrounding anything medicine, the pill. And sometimes it is just nice to hear the stats to put women's minds at ease, because, yeah, I don't think convenience always has to be a bad thing. You know, it's like it's extremely convenient, safe, allows you to operate and function at certain levels that you might not have been able to in case your hormones were out of whack, like you were explaining. But that's a very good reminder also that it can feel like things came back to normal or got fixed, and it's a good reminder to have women come see you. Like, do you think, I guess that's what you're saying, is seeing a naturopath, would that be a good place for people to start coming off of the pill, to kind of get to those root causes that had not necessarily been overlooked but had been masked by the pill?
Definitely. And for something like PCOS, which I see the most of, typically we see after 90 days, that's when like your symptoms will start coming up again. So it's just good to know, like, there's nothing wrong with the pill, but just know when you're taking it, you're not fixing anything really. And that's fine. Okay. When you come off, you'll fix it when you're ready.
I like that approach. So what are some ways or things anyone listening can start doing to help with their fertility?
Yeah, of course. So I could share a few with you. So the first thing I just wanted to mention, though, is the number one predictor of fertility is age. So we're really born with all the eggs that we have, and then it decreases as we age. And fertility is going to decline over time because of like egg quality, egg quantity, and also our hormone levels decrease. And right now there's no test to measure egg quality, but we do know part of the reason that it declines is because mitochondria within the egg decline, and the mitochondria are responsible for the energy in the egg. So what we really want to do is focus on mitochondrial health to give the eggs the most energy we can as we age.
Okay. And so, what are the most optimal ages to get pregnant? Because I think a lot of different things get thrown around. So I was just curious, what is really, I mean, if we take out of consideration all of like how our lifestyle has changed and how women are having babies later in life, what would be the most ideal time frame to have a baby?
Well, typically fertility starts declining at 35. The egg quality starts declining. But that doesn't mean that you can't get pregnant. Like, everyone's different, right? Mm-hmm. So it's really a case-by-case basis. But overall, after 35, we start seeing a decrease in egg quality for sure, and infertility.
Perfect.
Okay, so a few tips that I can share with you. So first of all, the most important thing is diet, right? So, and this is something that most people like you have control over, and a lot of people aren't, and not on purpose. They're just not getting enough of the right nutrients that are really important for fertility, and those would be lots of antioxidants. So like lots of fruits and vegetables, more vegetables, of course. Lots of protein. A lot of people aren't getting enough protein. That's the number one thing I see. We'll do a diet diary, and we'll go through the day, and like protein is usually very low in women.
Okay.
And then healthy fats. Healthy fats are really, really important for egg quality as well. And not only for egg quality, but also for when you're pregnant, for baby's brain. We all hear a lot about like DHA, but then we can't forget about EPA, because EPA is really, really important for mom's brain and mental health during pregnancy and postpartum. So you really want to make sure you're getting that EPA and DHA. Yeah. And then the next thing that I can tell you about would be regular exercise. So of course, everybody knows about it, but most of us are definitely not getting enough, especially in our like post-pandemic world. We're kind of used to like sitting. So trying to like get back into that. And it's because exercise is really important, obviously, for metabolic health, to maintain a healthy weight, to balance your hormones, and also to bring blood flow to your reproductive organs. It's really, really important. And I also recommend to all my clients to see an osteo, because you guys can also like give them the appropriate exercises. You can help them to strengthen the pelvic floor, prepare them for labor, and for postpartum, right? And really to like strengthen the core, and your back. So to really prepare you for pregnancy. The other thing I want to stress is trying to get your lab work done. When you're preparing to get pregnant, you want to make sure that you're not deficient in things like iron, B12, vitamin D. Those are common deficiencies that we see. And those are also, they also have the ability to affect the health of your pregnancy and also the health of your child. So for example, iron deficiency is the most common nutrient deficiency worldwide. And it's been shown to increase the risk of lower birth rate and also lower cognitive function in infants who are born to mothers who have lower iron.
Wow.
So just really like getting everything checked and making sure everything's where it needs to be. Okay. I also want to stress the importance of starting a high quality prenatal. And even the CDC actually recommends just taking folic acid throughout your entire reproductive years, because that's how important it is, right, to prevent neural tube defects. So just like being on it just in case is a good idea.
Okay.
You also want to try and avoid endocrine disruptors. Now, endocrine disruptors are chemicals that have the ability to disrupt our sex and thyroid hormones, and they can also affect our fertility. So an example of this would be like BPA in plastic. So a really easy way to just start avoiding endocrine disruptors would be to switch over all of your plastic containers, all of your plastic bottles, and start using glass. And to really avoid microwaving things in plastic. That'll really help.
I still know so many people who do that. Drives me crazy.
I know, and it's like, it's the easiest one to do. Like
Yeah.
really easy. You can order the glass ones on Amazon and do whatever you need to do with the plastic ones. Use them in the garage or something. And then also avoiding like parabens, phthalates, lead, pesticides. Pesticides is an easy one. There's a list called the Dirty Dozen, and they are the most sprayed fruits and vegetables. Just avoiding those can make a huge difference in your exposure to pesticides. So you just want to do that. And then like check your personal care products for the BPAs that I mentioned. This is like a whole topic on its own, but those are like
we'll
some
have to
good.
have you back to talk about it specifically.
Yeah, like I could talk for an hour about that, but those are just like basic things that'll make a difference.
Yeah.
And then obviously smoking. Smoking is extremely detrimental to your fertility, and it actually can accelerate how fast you reach menopause. So by 1 to 4 years, you can go into menopause early just from smoking. And if you think about it, like if you're having babies later, like you're trying, and you've also like accelerated menopause, you're actually like closing your window even more. And that's, I know it's not simple, but it's like one of the things that you can do. It's not easy for everybody.
And is that specifically smoking cigarettes?
Yeah, that's cigarettes. But then of course, like smoking weed also does affect sperm parameters for sure. So if you can decrease that would help as well. Okay. Yeah.
Interesting.
Yeah.
Oh, I wanted to ask something. Oh, where was it? Oh, yeah. So what is your recommendation usually for women? How much protein should they be aiming to have?
So you want to have about 1 gram to kilogram of body weight. If you're vegetarian or vegan, you want to have 1.1 grams per kilogram of body weight. And that's just because vegan or vegetarian protein isn't as well absorbed as animal proteins.
1.1 grams per kilogram of body weight.
Yes.
Okay.
That's a general recommendation. So just aim for that.
Perfect. And then I had a question about exercise as well, because I had been seeing online that for women who are having difficulty with fertility, to avoid HIIT training. And I was wondering if you had kind of an opinion on that.
So obviously over exercising can actually stop ovulation. We see that in like elite athletes. And then it can increase cortisol levels, and that's where it comes from. But I don't know if doing HIIT training, if like for some people HIIT training is fine, right? Everyone's different. And for some people it makes them feel really good and it reduces stress. I don't know if you could say that like HIIT training is bad for all of women of reproductive age. I really don't think you could say that. I really think it's a case-by-case basis. But there is a general rule of thumb that the amount of exercise that's good for fertility would be between 4 and 6 hours per week. And you want it to be at like 70% of your maximum heart rate. But that's just for like the average person. It's just like a general rule.
Okay. I like that. I like concrete rules. We've been focusing a little bit more on women, even though we were talking about how it's usually 50-50 shared underlying issues is also men. Wow, that was a weird way of wording that, but you know what I mean?
Yeah.
So do you work with men, and is there anything that men can do in naturopathy to help with their, in their fertility journey?
Yeah, so I do work with men. Obviously, I work with a lot more women because women are usually the ones to seek out help. And it's usually the female partner that then ends up bringing the male partner, partially because I'm like, bring them, because they are half the equation, right? It's usually just the woman doing all of this work, all of the workup, right? And then you wait till like everything's been investigated and everything's fine, and then they bring in the male partner, then they start doing the sperm analysis, then they start investigating, and then you have to wait a whole another 3 to 4 months once you figure out what's wrong with the sperm to start like optimizing sperm health, because it really takes like a good 3 to 4 months to optimize sperm health and egg health.
Okay.
And the thing about sperm as well is that sperm health has actually decreased since the 1940s. And we don't exactly know why. There's lots of contributing factors. But the World Health Organization in 2010 actually changed the minimum cutoffs for sperm parameters. And they made them lower so that they could accommodate and like reflect the declining sperm quality. So sperm quality is a lot lower than it used to be. And there's a lot that males can do to actually improve their sperm quality that we don't really focus on as much. So that's what I tend to work on with the male partner. So something that a lot of people don't know that I thought was a cool fact as well is that there's like a lot of medications that affect sperm quality, and something as simple as like Tylenol, that's something like lots of people take all the time, actually affects sperm quality for 24 hours. So if your partner is taking Tylenol every day for like a chronic injury or something, it could have been that's like affecting their sperm quality. Something
That's
really
really
simple
interesting.
sometimes.
I
So
had
it's
never heard that.
Yeah, so it's really good to just like when you take a case and you look at the whole story, and then when we try and connect the dots, sometimes there's just something really small that you can change. Sorry, I don't remember the beginning of your question. Did I answer your question?
I think you answered my question.
Okay, just making sure.
Let me. Yeah, you definitely answered it.
Okay.
So I also wanted to know, do you have, because we went over tips for women, do you have any general tips for men to help with their fertility?
Yeah. So obviously diet's huge. But something that a lot of people don't realize when it comes to male fertility is that cardiovascular health and like metabolic health has huge effects on sperm health. So cardiovascular health actually can like affect testosterone and like lower testosterone, and that actually affects sperm quality. So obviously diet and exercise is going to be really important for that. Typically for the male partner, you want to avoid trans fats. So they found that men who consume more trans fats actually tend to have lower sperm counts and lower testosterone levels.
Okay.
When it comes to alcohol, The occasional drink here and there is fine, but they found that men who binge drink or drink daily actually have lower sperm quality. And it actually shows that consumption of alcohol, well, excessive before IVF, can actually lower success rates. So alcohol is something like you don't have to completely eliminate it, but just control it. What else can I tell you?
I think you were going to talk about coffee.
Oh, yes. Okay, so a common question I get is coffee. And like looking at the research, coffee doesn't really affect sperm quality, but it's what you put in your coffee you need to think about, right? So if you go to Starbucks and get like one of those fancy like caramel, macchiato, whatever, I don't know their names, and you put loads of sugar, well, like that's not good for like your blood sugar, right? And that can have huge effects on your sperm quality. And you want to make sure that they're eating lots of healthy fats. So again, like lots of fish, olive oil, nuts, lots of antioxidants as well. So that's good for sperm health too. And then again, smoking and drugs is going to damage sperm for sure. And then some evidence-based like supplements and nutrients that you could use for sperm quality as well, because sometimes that's easier to do than like making all these lifestyle changes if your partner is not as invested as you are. So looking for supplements that have like vitamin C, L-carnitine, CoQ10, vitamin D, selenium, folate, and zinc. Those are all nutrients that are like backed by science that actually help with sperm quality.
Perfect. Okay, well that's pretty much sums up all of the questions that I had. Was there anything else that you wanted to get out there that make sure that people knew about naturopaths or fertility? Anything else that I may have missed?
Let me think. I mean, I could say so much, but I think like I have lots more to say, but I think we covered a decent amount. And I also just want to emphasize that everything we spoke about isn't meant to like scare you and like you need to do all these things to improve your fertility. Like most people don't have problems with fertility and you'll be okay, but it's just nice to know that like age is a factor. But there's all these things that you can do to actually help your fertility, right? There are things that are actually in your control. And sometimes that's nice to know because especially when you are someone who suffers with fertility issues, there's so much that's out of your control. And these lifestyle factors are something that like you can actually do, right? And especially if you're someone waiting for IVF, you might feel like that's wasted time and there's nothing that can be done during that time. But you could take that time to really work on your lifestyle and get into optimal health during that time, right? And implement some of these changes and other ones as well.
I love that. And how can people get in touch with you, book a session, follow your content? How do they get your app?
Yeah, so if you want to download my app, it's on the App Store right now. Right now it's only for iOS for now. Okay. And a new version will be coming out next week. And this new version is actually going to have a community where I'm posting educational content. I have loads of videos on how to track your cycle since I kind of like went through it really quickly today. But if you want to hear about it in more detail, I have a course on that in there. It's completely free. And you can download the app on the App Store. It's called Fertilitae. And I guess we'll write it below the video somewhere.
Definitely.
Yeah, you can download it. It's free. There is like other parts of it that you can pay for, but all of the cycle tracking and all of that, it's definitely free. You can contact me at ash@fertilitae.com. You could find me on Instagram at Fertilitae, on TikTok at Fertilitae. And you can just email me. I do one-on-ones. I also do groups. Yeah.
Perfect. Well, I think this was a great starting point to introduce people into the naturopathy world and how it can help with fertility. But I would definitely love to have you back on at some point to talk about some more specific subjects. But yeah, thank you so much for coming.
Thank you for having me.
And I hope to have you on here again.
For sure. Thank you. Have a good day.
Thank you. Have a great rest of your day.